Because we don't necessarily have a big name or big hospital kind of attached to us, sometimes I guess the stigma would be like maybe if it's cheaper, that it may be less of a quality, but I don't see that. I see a lot of the providers, they know that we serve the underserved, so a lot of their hearts are actually in providing like the best care. You know, they actually go above and beyond for their patients because of the population that we have. And I feel like that breaks the stigma.
Because a lot of clinics don't offer services that we offer without an extensive cost, or they make sure that you have insurance. So to lead off by saying it doesn't matter if you have insurance or not, we're here to serve you, and then provide you with a dental service. I don't know a clinic that provides dental except the health department for individuals who are underinsured or underinsured. So I think that that's what stands us alone, is that we have qualified professionals that are from different organizations who are certified, who are providing services to not just our population, but in other areas that are top notch.
But when you stop and pause, the high number of individuals that are underinsured or at least no insurance in some cases, then they certainly deserve the same level of care, healthcare and compassion that someone that is employed with a major organization that has fully, is fully insured. And so I just believe that we cannot leave anybody out of this healthcare equation. And again, my role is to ensure that I do everything I can to support our staff and providers in creating that environment that invites folks in.
I think probably the easiest way to describe that is, one, all the physicians and providers that are here take a ton of pride in what we do. So we really show up to work every day saying, we don't want you to get care that's just good enough. We want you to get care that's excellent, that I would feel great. If my mom came to this clinic, I'd be thrilled. That's the kind of clinic I want to work at. If I can't respond to a family member saying, yeah, absolutely, come see us at United Health Centers, I don't think I would want to work here.
For some patients, they're surprised that we have all of the resources that we have here in terms of having a pharmacy on site and having access to occupational therapy on site through our partnership with Winston-Salem State, and that all of these folks are accessible immediately upon walking in. I think there is sometimes this thought that clinics that are federally funded are somehow not providing high quality care.
With United Health Centers, we're not gonna turn a patient away. We're gonna figure it out to see how can we care for this patient with the resources that we have. Patients, they may be able to walk into the emergency department and be able to be seen, but that's not comprehensive care. Here, they can receive primary care services, and we treat them as a primary care patient versus them going to an emergency department because they have to see them, but they don't have to pay that bill.
The first, challenge that we have is, first of all, making sure people know who we are, right? Because if you go out and you ask a bunch of people in Winston-Salem, even in this neighborhood, in the neighborhoods that we serve, what's UHC? What's United Health Centers? They go, I don't know. That's a problem, right? That we have to solve. So then once they figure out what UHC is, and then they go, oh, you're a federal qualified health center, you're a community health center, then there's a stigma that comes along with that the quality of care is less than. When the providers that we have, they graduated from the Dukes and from the Meharry medical schools, and they actually served patients at some of the largest health systems in North Carolina. And so that is definitely a myth. That is definitely a falsehood, because the quality of care that you get at United Health Centers is, I think, a step above, because of the population that we serve and because of the mission. So the majority of the people that are on our team, they'll talk to you about, compensation. They'll talk to you about, their workload, but then they'll also talk to you about the mission. And the mission is super important to the people that work here.